There are several reasons why we may wish to preserve eggs or embryos, and these could be due to a cancer treatment, for example. You may want to freeze your eggs before a cancer treatment to preserve your fertility for the future. For delaying motherhood, our socioeconomic conditions mean that many women are choosing to become mothers later in life, or perhaps you know you have a disease which affects your ovarian reserve, such as endometriosis. In these cases, we would want to have a look at how can we preserve your fertility for the future. One option is egg vitrification, which involves the ultra-fast cryopreservation of your egg cells, which will then be stored in liquid nitrogen until you require them in the future. The main advantage of egg vitrification is that it can maintain the quality of your oocytes. They have good survival rates following the freezing and thawing process. In order to perform egg vitrification, the woman first needs to undergo ovarian stimulation. Hormonal medication is administered to develop several eggs at once. When this will be monitored by ultrasound, and when the woman has her eggs developed, they will be collected in a surgical procedure of egg retrieval. When the eggs have been removed from the body, they will then undergo the process of vitrification. Vitrification involves the very fast freezing of the egg cells using cryoprotective agents to prevent ice crystals forming inside the eggs, and therefore they have very good survival rates. This fast freezing is down to minus 196 degrees centigrade, and then they will be stored in a special straw structure in a vat of liquid nitrogen, where they can remain for many, many years without undergoing any kind of degradation. When the woman is ready to become a mother, she can use in vitro fertilization techniques. The egg will be thawed, fertilized in the laboratory, and transferred to her uterus with the aim of producing the pregnancy. An alternative to egg vitrification, or freezing your eggs, is freezing your embryos. The same kind of cryogenic process is used, but the difference here is instead of freezing the egg cells, the eggs will be fertilized first in the laboratory with the man's sperm, and the resulting embryos cultured for a few days to allow them to develop. The embryos themselves are then frozen. Obviously, this technique is more suitable for a heterosexual couple who are in a committed relationship who plan to have children together in the future. There is also a process known as ovarian transposition. In this process, the ovaries are surgically removed and transposed to another part of the body, where they will be stored with the adequate blood supply to maintain their integrity. This is done when perhaps the patient is going to undergo radiotherapy or chemotherapy in the area of the ovaries. By placing them out of reach of the treatment, you are preserving your fertility. They can then be put back into their proper position later on in life when the cancer has been cleared. The experimental technique of freezing ovarian tissue is an idea for preservation of fertility for girls before puberty who may have to undergo a cancer treatment. As they have not yet got to puberty, their eggs won't be developing in their ovaries, so the normal process of ovarian stimulation cannot be carried out. In this treatment, a small slice of ovarian tissues, which contains all of the follicles which will be responsible for the developing eggs in the future, will be removed and stored and vitrified and stored in liquid nitrogen. At a later date, this ovarian tissue, when the cancer has cleared, can then be placed back into the body, perhaps in the ovaries or maybe in another location, with the aim that the girl in the future, or the woman now, can achieve pregnancy.